close your eyes and plug one nostril, and then I'll hold something under your other nostril, and I want you to tell me what it is.
Peppermint.
Yes. Okay, go ahead and plug the other nostril, and we'll do the same thing. Copy. Okay, good. You can open your eyes. So now what we're going to do is a couple tests for your vision. So I'm going to use my fingers, and I'm going to come around the sides of your body, and I want you to tell me when you see my fingers.
I see them.
Okay. Now I'm going to wiggle them, and I want you to point to which one's wiggling. Okay, good. So now we're going to do the same thing, but this way, making sure that I'm on your eye level.
Okay.
Can you see them?
Mm-hmm.
Now?
No.
Okay.
I can see them.
Okay. Now I'm going to wiggle, point to the one that's wiggling. Okay. And the last one we're going to do is I'm going to have my thumb up and a pointer finger up. And then I'm going to say finger or thumb, and I want you to look at whatever I say, but just use your eyes, don't move your head. Okay? All right. Thumb. Finger. Thumb. Okay, good. Okay, so what I'm going to have you do now is just cover one eye and then use the other one to read the lowest line that you can that's not blurry.
Okay. LEFODPCT.
Okay, now cover the other eye and then do the same thing. If it's the same line, just read it from the other direction.
Okay. TCDOFEL.
Okay, so the next thing that we're going to do, I'm going to have you cover one eye for me, and then I'm going to cover the same one, and I'm going to put my finger over here. Let me know when you can see it.
I can see it.
Okay, now let's do the other eye. Do the same thing.
I can see it.
Okay, perfect. So now I want you to go ahead and just sit still, and I'm going to use this light and look in your eyes for your pupils to constrict. Okay. And now what I want you to do is look at the tip of this pencil. I'm going to draw an H in the air, and I want you to just follow that with your eyes and keep your head still, okay?
Okay.
Okay, and now what I want you to do is just focus on the tip again, and I'm just going to move it towards your face, okay? Okay, now what I'm going to do is I'm going to have you close your eyes, and then I'm just going to lightly touch your face with this cotton ball. Is that okay? It's going to feel like that.
Okay. Yes. 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 Yes.
Okay, and so now what I'm going to do is use a safety pin to do pretty much the same thing with the safety pin. Just going to clean it first, and what you're going to do is when you feel this side, it's going to feel like that. I want you to say dull. When you feel this side, it's going to feel like that. I want you to say sharp, okay?
Okay.
Okay. Go ahead and close your eyes.
Dull. Sharp. Dull. Dull. Sharp. Dull. Sharp.
Okay, perfect. Go ahead and open your eyes. The next thing I'm going to do is I'm going to have you kind of clench your jaw muscles for me. So kind of just clench your teeth together.
Okay.
And is it okay if I touch your face?
Mm-hmm.
Okay, I'm just going to feel you clench. Okay, relax and clench. Okay, good. And now what I'm going to do is just kind of push down on your jaw. So go ahead and open it up a little bit. And I'm going to try to push you down. Don't let me push you down. Okay. Now keep it open, and I'm going to try to push you up. Don't let me push you up. Okay. The last one we're going to do right now, I'm going to put my thumb on your chin, and then I'm just going to tap it with this hammer.
Okay.
And we should see it move up.
Okay.
Okay, there we go. So now what I want you to do is go ahead and give me a happy face. How about an angry face? Okay, puff out your cheeks for me. And then raise your eyebrows, just your eyebrows. Okay, good. Now do a shocked face for me. Okay, and then I want you to close your eyes as much as you can. And then I'm going to try to open them.
Okay.
Okay, good, good. All right, so the next one we're gonna do is I'm gonna use a Q-tip. I'm gonna have you close your eyes and then stick your tongue out.
Okay.
And then I'm going to put something on your tongue. I want you to leave it out of your mouth and then tell me what you taste.
Okay.
Okay.
Sugar.
Sugar? Okay. Go ahead and keep them closed. We're gonna do one more. Okay.
Salty.
Salty. Okay. Well, I'm gonna give you this water to wash that down, and then I'm just gonna feel your throat while you swallow, okay? gonna write them together and it's gonna make a sound. I want you to tell me if it sounds equal in both ears, okay?
Okay. Yes.
Okay, now what I want you to do is point to which one's making that noise. Okay?
Okay.
So now I'm gonna use this tuning fork and it's gonna make a sound. I want you to tell me if you can hear it, and then I'm gonna put it in a different spot and I want you to tell me which one sounded louder.
Okay.
So close your eyes for me.
Okay. The first one sounded louder.
Okay.
I hear it. The first one sounded louder.
Okay. Last one. Does it sound equal on both sides? Yes. Okay. So the next thing that we're gonna do is I'm just going to tilt your head down a little bit and we're gonna go to the left and then to the right and then back.
Okay.
And I want you to keep your eyes focused on my nose.
Okay.
Okay. Okay. Okay. So now for cranial nerve 8, we are going to be doing a little test called the Dix-Hall's Pike. I'm going to going to rotate her head for her towards me, and I'm going to stabilize her neck, and then we're going to go down really fast, and I'm going to have her extend off the side of the table. We'll stay there for a minute. For the sake of the video, we won't stay there for a minute, but normally we would. And normally I would test both sides, but I will just be showing one side. So I'm going to go ahead and turn your face towards me and stabilize like this. You can grab onto my arm if you want, and then we're going to go down on 3, okay? 1, 2, 3. Okay, so keep your eyes open and on me, and I'm just looking at your eyes the whole time, looking for reaction. Are you nauseous at all?
Mm-mm.
Okay, we're going to come back up. So if you're nauseous or dizzy or anything, let me know. And I have a trash can just in case she is, and I would stay with her to make sure she's okay before doing the other side. Are you okay?
Mm-hmm.
Okay, awesome. Okay, so now what I want you to do is just go ahead and stick your tongue out of your mouth, and then go ahead and say "ah" for me. I'm just gonna look. Okay, good. And then can you shrug your shoulders for me? Do you have any pain with that? I'm just gonna push down on your shoulders. Don't let me move you. Okay. Now can you look to that shoulder for me? I'm just going to put my hand here, and I don't want you to let me move you, okay? Okay, now let's do the other one. Are you feeling any pain with those?
No.
Okay, perfect. For the whole time we've been doing all of these assessments, I have been listening to her when she speaks to see if there are any abnormalities. So now I'll be going over the abnormal results for the cranial nerve assessments. For cranial nerve 1, a positive result is going to be if the person cannot smell in one or both of the nostrils, or if they guess the smell wrong. For cranial nerve 2, a positive result is going to be if the peripheral vision is narrow when testing for visual fields, or if they read their line on the Snellen test, if it is blurry, or if they cannot read that line. For cranial nerve 3, a positive is going to be if there's uneven eye movement when doing tracking, if you see any saccadic eye movements or inability for the eyes to follow with the convergence test, and if their eyes do not react to the pupillary light response. For cranial nerve 4, a positive result is going to be if there's uneven eye movement during tracking. For cranial nerve 5, a positive test is going to be if the patient is unable to identify if they are feeling a light, a deep, or a sharp, a dull or a sharp touch on the face when prompted, or if they're having a hyporeflexive response to the jaw jerk reflex, if there's some asymmetry in their muscles when clenching, or weakness when having their jaw resistance tested. We did not test corneal reflex today. For cranial nerve 6, a positive is going to be if there is uneven eye movement during tracking. A positive test for cranial nerve 7 would be if the patient is not able to taste whatever is placed on their tongue, or if they are not able to perform facial expressions when asked to do so. For cranial nerve 8, a positive test would be the inability to hear the finger rustle in both ears and to tell which one is having the finger rustle next to it. Another positive for this nerve is if they cannot hear the tuning fork against their ear or on their mastoid, or if they say that it is louder when placed on their mastoid, along with the inability to hear the same amount of sound from the tuning fork on the top of the head.
For cranial nerve 9, we test gag reflex, but we will not be doing that. Cranial nerve 10, a positive is going to be hesitating when swallowing and feeling asymmetry in the muscles when swallowing, along with the uvula moving in one direction to the left or to the right rather than going up when saying ah with the tongue out. For cranial nerve 11, a positive test is going to be decreased strength and symmetry of the muscles in the upper traps and the sternocleidomastoid muscles. And then for cranial nerve 12, a positive test is going to be the inability to stick the tongue straight out of the mouth. And then if they are having any trouble with speaking, articulating words, or if they are making garbling sounds.